Hi, it's Dr. Adrian from Advanced Dental Artistry here in West Perth. One of the questions that we're often asked is what are the most complex cases that we deal with? Well, when people are actually going to lose all of the teeth, whether it's due to decay or maybe gum disease, or maybe they've already lost all their teeth and they're wearing dentures and they're looking at all-on-4 treatment, as long as they've got enough bone, it's probably a very simple procedure to actually replace all of their teeth, because we could then place the implants in and we can actually design the smile in whichever way we want. The actual surgery part is of course very complex, and you do need a very experienced team to actually do this treatment. It becomes much harder though when we need to keep teeth, because naturally when we need to keep teeth we can't just place implants and place new teeth over the top. We have to work around the teeth we have. To give you an example of some of these complex cases that we treat, we saw a patient in Gabby who actually wanted cosmetic treatment when she came to see us, and then when she went home over the next week or so, she actually tripped over and smashed all of her front teeth. They ended up being basically intruded into her jaw, and unfortunately these teeth couldn't be saved. She did fracture her upper bone, so her maxilla bone was actually fractured, and because she lost these teeth we had to then not only do cosmetic treatment but also replace these front teeth actually with dental implants. And you can see this case from before and after, and it is quite graphic of course because she did have the trauma to her front teeth, but you can see the end result. One of the other things that's a very complex case too is gummy smile, because gummy smile has a number of reasons why patients are gummy, and it can sometimes be just because of excessive gum, but usually it's because of excessive gum and also a hypermobile lip. And these are very challenging cases because naturally we're going to keep the teeth, but we have to work around how do we actually do a gum lift, how do we actually engineer the new teeth and design the smile so that the smile is actually perfect. The other complex problem we see is actually misalignment of teeth, and there's really certain, I suppose, different degrees of misalignment. In the cases that we see, there are some patients where the misalignment allows us to put porcelain veneers over the teeth in order to correct the position of the teeth, and with other patients unfortunately we have to remove teeth in order to create space and then use porcelain veneers on the teeth. Of course with these patients they are offered the option of braces or orthodontic treatment before doing porcelain work, and it's really up to the patient to make a decision on what they feel most comfortable doing. The other problem we often see is actually when patients have baby teeth remaining, and when patients have baby teeth remaining or have lost teeth and they've got some baby teeth and some permanent teeth, they can be some of the most complex problems to actually fix. And this is Jonathan, who's actually come in, and he's got an issue not only with the fact that his canine teeth are actually in the lateral position, so instead of being in the correct position they've actually moved forward, but he's got baby teeth, he's got a problem with his bite, and for us to actually get good aesthetics, which is what he wanted for his wedding, we have to do some complex cosmetic treatment in order to actually fix his smile. The other thing is actually midline issues. Midline issues are very complex, and a lot of the times we'll find that the midline is not always in the middle of the face for most patients. However, when you've only got one front tooth present, this is when it becomes quite challenging. In this case here, what we've actually got is we've got Cameron who's come to see us, and after a hockey accident he actually lost one of his front teeth, and the orthodontist unfortunately moved his only front tooth to the middle of his mouth. And in doing so what's happened is of course it's created not only a problem with just that one front tooth, but also his midline has shifted. We can't change midline when we're doing cosmetic treatment, but we can hide it and disguise it, and you can see his final smile here, what a difference it's made just to get the proportions of his teeth right, but to also move the midline a bit to give him a great smile. And the last problem we see is congenitally missing teeth, and this means that the permanent teeth didn't come through. One of the very common congenitally missing teeth is the lateral incisor on the front. If the lateral incisor is actually missing, we've only really got two options: either to replace it with dental implants, as you can see in this case where we've actually put dental implants in, and then we've put some implant porcelain crowns and some veneers on the front teeth in order to improve the smile, all the way through to sometimes the canine teeth are actually in the position, very similar to Jonathan's case. The canines are in the position of the laterals, and we have to change their shape in order to make the smile look beautiful. All of these cases are very challenging, and no case is actually similar, and it's really important to do very careful planning, to have a really good team to ensure that the design of the smile is correct, to always run a trial smile so that patients are actually happy and comfortable before the patient decides on the final porcelain, and to ensure that the final porcelain is actually designed and bonded correctly. If you have any questions, please give us a ring at 100 Smiling. I look forward to one day seeing you in the practice.